The Centers for Medicare and Medicaid Services have begun approving changes for Medicaid home and community-based services during this coronavirus national emergency. Now, most Medicaid home and community-based services are provided through waivers to the states. These are Section 1915C waivers. There are a lot of waivers that are being discussed lately. These are the ones that impact the ability of people to get their needs met in a home or community setting instead of in an institutionalized setting. Now, typically, there's not a lot of flexibility for states to change these waivers. In the time of an emergency, however, there's a certain appendix that goes along with these 1915C waivers, Appendix K, that gives the authority to the states and the federal government to amend, to modify, to change these waivers in a time of emergency. Now, the amendments could be used to modify or extend eligibility, covered services, changes to service limits, service planning and delivery, service settings, even the providers and even the oversight of those providers. Now, an example that some states have latched onto is the ability of a state to ask that maybe a family caregiver be treated as a provider in some instances and even be paid for their time providing that services. Typically, something like that is not permitted in a lot of these community and home-based services. Now, on March 13th, President Trump did declare the coronavirus a national emergency. States at that time started asking permission to amend their Section 1915C waivers. 3 states have been approved so far, the states of Pennsylvania, West Virginia, and Washington. You might recall that Washington state also asked for a Section 1135 waiver for additional flexibility to other portions of its state Medicaid program. The Centers for Medicare and Medicaid Services has posted sample Appendix K templates for states that are coronavirus specific to give guidance to states that might want to seek additional flexibility in their own programs. They also have some COVID-19 or coronavirus specific instructions for states, as well as all of the approved letters coming to those 3 states thus far that could be used as guidance for other states. We put a link in the description below so you can read all of those resources coming out of CMS.